Hi, my name is Alicia Carmack, and I am here today to present my Advanced Health Assessment from Maryville University. For the purpose of this presentation today, some of the presentation will be somewhat mocked up. Initially, when you come in to greet the patient, you want to assess their name and date of birth to make sure that you're with the right patient. Also, you want to make sure that they're in a comfortable setting and they're comfortable clothing. You would sit down and have an interaction with the patient addressing their chief complaint. For the purpose of today, the chief complaint for the patient is their annual physical. After addressing the chief complaint in their health history, we would move forward into other portions of the health history, like their past medical history, their medications, allergies, surgical history, social history, family history, and then we would move forward into the actual exam itself. For this purpose, we would go ahead at this point and have the patient leave the room, empty their bladder, put on a gown. The medical assistant would obtain their height and weight and their blood pressure and other vital signs. For today's purpose, we already have our patient ready to go. This is Shirley, and I'm going to start with the head and neck assessment. And at this point, I'll go ahead and start with the cranial nerves just so I don't leave them out. Basically, when we assess for the cranial nerves of the patient's face, we want to make sure that they are able to do certain tasks or movements. So for this purpose, I'm going to have you say cheese, puff up your cheeks, grimace, stick out your tongue. And so we've assessed her cranial nerves 5 and 7. We'll also go ahead and move forward to check her sensation, which also deals with cranial nerves. And then her 2-point discrimination. So this is considered soft, and this will be sharp. So we'll have the patient go ahead and close her eyes.
Sharp, soft, soft, sharp, soft, sharp.
Okay, and then I'll go ahead and move forward into her 2-point discrimination. So I'll have you close your eyes again. Well, you can open them. Again, so that you know this would be 2,
Okay.
and this is 1.
What? Okay.
Okay, so
1, 2, 1, 2,
and then I'll go ahead and do your other side.
2, 1, 2, 2, 2.
Okay. And now that we've assessed that portion of the cranial nerves, then as I continue to go on, I will also assess them as I do her eyes and her ears. I'm also going to have you squint your eyes. Perfect. So assessing back at the head, basically we want to look at the patient, see if they're disheveled, what kind of affect that they have, if it appears that they have good hygiene. I'm going to go ahead and actually assess the patient's head. So I'm going to give her hair a good feel. I'm also looking to see if she has good sheen or shine to her hair, if her hair is soft, the texture of the hair, if she has any sores or any lesions or bruises on her head. And then also the placement of the hair, making sure that there's no bald spots. While I'm in this position as well, I'm going to check for symmetry. So we want to make sure that her eyebrows, her eyes, and her lips are all symmetrical, as well as her ears. So I'm going to go ahead and lift her hair. Her ears are symmetrical. While I'm here with her ears, I'm going to go ahead and just feel the actual ear itself. Her ears feel fine. There's no lesions. There's no sores, no drainage. And then I'll go ahead and assess her eyes, her ears, her nose, and her throat at this point. As well, I'll go ahead and don some gloves since we're already at this point. When we assess the eyes, we want to make sure that we look at the outside appearance of the eyes. Again, addressing the eyebrows and eyelashes. There's no lack of hair or loss of hair. There's no balding. And then looking at the actual eye itself, I'm going to go ahead and lift up her eyelid. Her conjunctiva looks good. There's no redness. There's no redness or drainage on this side. And then same goes as here. We also look on the other opposite side just the same. It looks good. We also want to assess to make sure that there's no fat deposits. I'll have you go ahead and close your eye. They are symmetrical as well. There's no sores or lesions. And then we would also go ahead and palpate to make sure that the lacrimal glands aren't enlarged. There's also no drainage as well. At this point, I'm going to go ahead and assess her facial bones and then also check her sinuses. So I'm going to give a little press here. Any pressure or pain?
No.
Okay, any pressure or pain?
No.
All right. Any pressure or pain?
No.
And then here?
No.
Okay. And then while I'm at this point as well, I'm going to go ahead and check for her temporomandibular joint, or TMJ. So basically feeling right here in this sort of preauricular area, I'll have her go ahead and open and close her mouth. And there's no clicking, there's no pain when she opens or closes. And then at this point, I'll go ahead and feel her nose. There's no sores, no lesions. It doesn't appear to be tender. It is midline. I'm going to move on to her eye exam. The lights in this room do not dim, so at this point we'll just go ahead and do it as best we can with her, with the lighting that we have. I'll have you go ahead and focus in on my nose. And she does have a good light reflex. I can also see the light off of her eye as well. I'm going to go ahead and assess your eyes, and then we'll go ahead and utilize our Snellen chart and the Rosenbaum. Oh, you're okay. I can see her cornea and also her retinal vessels. And I'll move over to this side. Sorry. It's okay. And again, I can see her cornea and her retinal vessels as well. As far as the cranial nerves go, the testing of the mock-up of the Snellen chart that we have, as well as the Rosenbaum chart, this is testing cranial nerve 2. So basically I'll have you go ahead and cover one side, and then you'll read the lowest line possible that you can see.
Okay. DKNTQULJB.
Okay, and then we'll switch to the opposite side.
DKNTQULJB.
Perfect. So the Snellen assesses from about 20 feet away, and then this is the Rosenbaum. It's about 14 inches away. So same thing, I'll hold if you want to cover one side and read the lowest line that you can read.
FLHTO.
And then the other eye.
FLHTO.
Perfect. And then at this point, we'll go ahead and also assess her for extraocular movements and also her peripheral vision. So I'm going to go ahead and have you again focus in on my nose. I can see him. Okay. I can see him. Okay, perfect. And then also from this angle here, you're going to let me know when you see that my hand is moving.
That
Okay,
one's
perfect.
That one's
Perfect. And then I'll go ahead and have you follow my finger. So she doesn't exhibit any nystagmus. And we're checking cranial nerve 3, 4, and 6. And she has perfect extraocular movements here. I will go ahead at this point and move on to her ears, her nose, and her throat. When we assess the inside of the actual ear on an adult, we want to make sure that we lift up and back on the top of their ear. I'm going to enter into her auditory canal, and it looks nice and pink in color. You can see the tympanic membrane. There's no wax noted at all, and she has an excellent cone of light. I'll switch to the other side. Again, making sure that we lift up and back. I'm going to go ahead and enter this into her auditory canal. It looks great. There's also no wax in here, and you can see her cone of light and the tympanic membrane. I'm going to go ahead and remove that. Since I'm already here at this point, I'm also going to go ahead and look inside her nose. Basically just looking at her nose, there's no deviation of the septum. I'm going to slide this in here. Her turbinates are nice and pink. They're not enlarged at all. There's no drainage whatsoever on either side. There's no deviated septum, and there's no sores or lesions. Actually, and then I'm going to have her go ahead and open her mouth and say ah. We're also checking for the gag reflex as well with this, checking the cranial nerves. Ah. Perfect. You can see in her adenoids about a grade 2 or 3. There's no lesions or sores inside of her mouth. Her tongue is nice and pink. And then having her stick out her tongue and then assess for any lesions or sores. There aren't any. She does look like she has a history of cavities. However, her dental hygiene looks excellent. And I do not see any lesions or sores, and the buccal area looks excellent. We're also going to go ahead and return back to her ears to chest to test her hearing. I wanted to make sure that I got everything while I had my gloves on. So when we test the hearing, what we're testing for is to see the Win and Weber test, Weber and Rin test, checking for vibration and how the patient can hear. Initially, when I do this testing, you're going to hear a nice gong, and I'm going to place it on top of your head, and you want to let me know if you can hear it on either side more than the other, or if you hear it equally. Okay.
I hear them on both.
Okay. And then we'll go ahead and test how she can hear the sound vibration on the bones. And basically we're going to be placing it behind the ear on the post-auricular area and then pre-auricular. Well, we're checking to see the distance, how long it takes for her to not be able to hear the vibration from the front to the back.
It's done.
Okay.
Done.
Okay. And basically you want to note the time on both, so how long it takes for her to hear it at the back of the ear and then as well to the front.
Done. Done.
Okay. And then I'll go ahead and move on to her lymph nodes. So when we assess the lymph nodes, we want to first assess from the front to the back. So we'll do the pre-auricular, or post-auricular, sorry, her pre-auricular. Then we'll check for the tonsillar right here. And then we want to do the submaxillary, submental. We also want to check her superficial cervical, her deep cervical, and her posterior cervical, and then her supraclavicular. This also can be done by having the patient shrug her shoulders. While we have the patient shrug, we can also have her press against us. This is also testing her cranial nerves as well. The last two cranial nerves that we did not assess are the taste and the smell. For this purpose, this also helps us to see her patency of her nose as well. So I'll have you go ahead and cover one side of your nostril, and we'll have you smell this. Okay, and then cover the other side. Smell. Perfect. And what did you smell?
Alcohol.
Very good. And then we'll go ahead and have you test her taste sensation, also assessing her cranial nerves.
Vanilla.
Very good. And then at this point, I will go ahead and assess the patient's back, and then I will listen to her back, assessing her lungs, moving to the front to assess the lungs and the heart, and then we'll have her lie back. So basically for purposes of this program, the patient is covered. However, when we actually assess the patient, we would have straight skin-to-skin contact. So basically, as I am assessing the patient, I'm looking at her skin, making sure that there's no lesions, no sores, looking for any suspicious moles that may have issues with irregular borders, shape, symmetry, color, and it appears that she does not have any. I'm also going to go ahead and feel her scapular region, making sure that everything appears to be anatomically correct. I'm going to go ahead and feel down her spine here. And I will go ahead and percuss. Any pain?
No.
It does not appear that she has any issue in her spine here. I'm also going to check for the costovertebral angle, make sure that there's no pain in the kidney region.
No pain. No.
Okay, perfect. And then we also want to check for tactile fremitus. So I'm going to place my hands on the patient over where the patient's lung fields would be and have her say 99.
99.
And again.
99.
And again.
99.
Perfect. At this point, I will also get my magic marker and my ruler, and we'll check for a diaphragmatic excursion. So I would percuss on the actual, I'll listen first, and then I will go ahead and percuss on the lung fields. So what I'm going to be listening for is any her bronchovesicular and vesicular lung sounds. We want to make sure that we listen in all fields. We want to make note of any change or anything that does not sound within normal limits. She has normal lung sounds. There's no wheezing, no crackles, no coarseness. I will go ahead and percuss, checking for any resonance. Also checking for the consolidation when we did the tactile fremitus. And then I'm going to be about this 10th rib here. I'm going to go ahead and percuss, have the patient take a deep breath in, and I will mark. And then I'll continue to percuss down, have the patient take a deep breath, and mark. I'll do the same on the opposite side. Deep breath, make a mark. Deep breath, make a mark, and then I would take a measurement, making sure that both were within normal limits for the diaphragmatic excursion. Now that we've assessed her back, we can move back to the front patient. At this point, I would go ahead and assess her lung fields and her heart, so doing the same as well. So basically, looking at the patient's skin, making sure that there's no lesions, there's no sores at all. Also checking to make sure that she doesn't have any moles that need assessing or addressed. And then basically, we would want to do the same thing. So checking for tactile fremitus, I'll have you say 99.
99. 99.
Sorry, that's good.
99.
Okay, and then we will go ahead and check for the heart as well. So we want to make sure that we check for the precordium. So I'll go ahead and press. And then you want to actually feel for the point of maximal impact of the heartbeat. And then we also want to feel her chest wall as well. And then at this point, we'll go ahead and listen to her lung sounds. We want to listen to all lung fields, just as we did on the back, on the front. And then we listen to them bilaterally, checking for any change, right versus left, left versus right. And then I would continue to check her lung sounds. And then we'll move on to the heart sounds as well. So we want to check the aortic, and then the pulmonic, the second pulmonic, the tricuspid, and then the mitral or apical. And then we could also check Erb's point as well, which would be back up here in between the second and third rib area. And then I would go back and assess her neck region as well. We want to make sure that we assess the thyroid and the trachea, so I'll have you kind of just extend your neck back a little bit, perfect. And so her trachea itself is midline, and then assessing her thyroid, I'll have you swallow. Okay, and so the trachea is midline and her thyroid is within normal limits. At this point, we would want to feel her carotids. We want to do one at a time, so not to occlude. Perfect. And then since we have a female patient, we would also have her do the breast exam. And then at that point, we would want to still assess the supraclavicular lymph nodes as well as her axillary lymph nodes, and then bilaterally her epitrochlear lymph nodes here. And then while we're at this point, I'll go ahead and just assess her arms before I have her lie back. So assessing her arms, her extremities are warm to touch, her hands are warm. She has good capillary refill bilaterally. Her skin, they're warm and dry. There is a little skin tear there, but otherwise the skin is nice, dry, and intact. And then I would feel for her radial pulses, and then her brachial pulse. Perfect. And then we'll go ahead and have the patient lie back at this point. For the purposes of time constraints, we normally would go ahead and re-listen to the patient. If need be, we would have the patient turn to the side. And as we have the patient turn to the side, just to make sure that if we need to hear for an S3 or S4 sound, we can do so. Sometimes removing pressure off of one side helps listening to that. We also would listen to the patient's lungs and again listen to their heart. At this point, I will go ahead and move on to the patient's abdomen. And again, we want to make sure that we use complete discretion. And so basically, when we assess the patient's chest before we would listen to their lung and heart sounds again, the patient would not be clothed. And we would, just like we would assess the abdomen, we would be looking at the patient, looking to see if we see any pulsations or any heaves. I'm going to go ahead and move on to the abdominal exam just for time constraints. So same thing, I would stand examining the patient, looking for any heaves any pulsations that I could see, and if there was any part that was not symmetrical. Then we want to go ahead and listen to all 4 lung sounds. All 4 bowel sounds, or bowel regions, 1, 2, 3, and 4. And then we also want to go ahead and switch over from our diaphragm to our bell, and we'll go ahead and listen to the abdominal aorta. We'll also listen for the iliac, renal, and then femoral pulses. And then as well, normally we would go ahead and don gloves. We want to make sure that we can feel the femoral pulses, and then we also want to check for any lymph nodes in the inguinal area. So I'm going to go ahead and listen to the bowel sounds. I would want to note if there's hyperactive or hypoactive bowel sounds or any absent in bowel sounds. And then I'm going to go ahead and listen for the abdominal aorta. And then the iliac. And then renal. And then also listening for her femoral. At this time, again, I would go ahead and don gloves and feel for her lymph nodes as well. I want to also go ahead and feel for the patient's liver as well as her spleen. And then we'll do a light palpation, and then we'll do a deep palpation so that we can also feel for the depth of the liver, the spleen, as well as the right and left kidney. So I'm going to go ahead and percuss at this point, so we'll feel for her ribs here. And we'll do the side, her spleen. And then I'm just going to do a light palpation here. And then we'll do deep. And then feeling for her kidneys. Perfect. All right. And then at this point, I'll go ahead and check the patient's lower extremities. I'm going to remove your little blanket here. So as we check the lower extremities, just like we did the upper extremities, we want to feel for temperature bilaterally. Her extremities are warm to touch. Her feet are just slightly cooler than her upper extremities. She does have good perfusion. I don't see that there's any fungus or any sores on her toes. And they do have good capillary refill. I'll also, while I'm in this position, feel her pulses. So feeling back behind the knee, we want to check for her popliteal. And then we also want to check her tibial, dorsal tibial pulses, and then the pedal pulses. Perfect. We also want to note if there's any issue with hair distribution on the legs. Her legs are shaven, they look great. There's no lesions or sores. While I have her in this position, I'll also go ahead and check some of her musculoskeletal. So I'm going to go ahead and assess her hips. I'm going to give them a feel. Any soreness or pain?
No.
Okay. And then we'll have you go ahead and bend up your knee here, and then we'll have it extend out. Any issue with that?
No.
Okay. And we'll go ahead and have you turn your hip. Perfect. And then we have your rest, and we'll do the same on the opposite side. We'll have you bend your knee, stretch it out. Any pain?
No.
Okay. We'll have you kind of extend it out. Perfect. Any issue?
No.
Okay. And then basically at the same point, I'm going to go ahead and have the patient sit up, and I'm going to check her reflexes here. outside this one. We'll go ahead and see her musculoskeletal. So I'll have you still sit.
Oh, sit.
Yep,
Okay,
sorry. And so I'm going to check her upper and lower extremities. So basically you're just going to extend out your arms and I'm going to have you, perfect, perfect. Just checking to see if the patient can, perfect. She is very strong, and so we'll go ahead and do the same with her extremities as well. So I'm going to have you extend out your legs and we'll have you push against me, perfect. Don't let me, yeah, perfect. Push out, perfect. Perfect, here. And I'll push down, you lift up. Perfect. When the patient was in the abdominal position or lying down, we also would want to assess when she sits up. And then I'm also just look at her abdomen. And then also in that section as well, I would have gone ahead and checked to see how she, with our hammer, how she did with reflexes of this sliding across her abdomen to see if her tissue kind of grimaced up or tightened up. I'm going to go ahead and assess her reflexes. So this would be the brachial reflex, so we just kind of have her relax her arm. See if there's any reflex. And then we'll do it at the knee here. And we elicited a reflex. Perfect. And then I'll switch over to this side here. We'll have you relax. Perfect. And then we also want to check back here in the Achilles tendon area. And then the only test that I did forget to test with her hearing is the whisper test. And so basically we do the cover, uncover. So since I'm on this side, I'll go ahead and have you cover your right ear, and I'm going to give you a series of 3 words, and you want to repeat those back to me.
Green, yellow, blue.
Perfect. And then we'll have you switch over to this side.
Purple, pink, yellow.
Perfect. So this should thus conclude my advanced health assessment for Maryville University. Sorry, I'll also have the patient get up and walk that we can assess her gait. So I'll have you go ahead and stand up. We'll have you go ahead and put your arms straight out, and we'll have you close your eyes. We want to assess to see if the patient wobbles or falls. While your eyes are closed, you also want to go ahead and take your pointer finger of your left hand and have that pointer finger hit your nose. Perfect, and then bring it back, and then the opposite pointer finger to your nose. Perfect, also assessing to see if she's going to fall. She's not. Have you go ahead and open your eyes. I'll have you squat. Perfect. And then we'll also have her go ahead and walk. You'll just walk normal to the doorway. We want to assess her gait, make sure she doesn't have any issues with walking. And then when you come back, it'll be 1 foot in front of the other. Perfect. So this does really conclude our advanced health assessment. Thank you, Shirley. This is Alicia Hacker, or Carmack, sorry.